So here we have the 10 ml red top Vacutainers. This is a dual-sided needle. So as you can see on the left side here, that's the part that goes in the Vacutainer, then the needle that will go in the patient or the patient's either their arm or the IV is what that goes in. And then you hook this in here. And there we go. We'll show you. Hopefully this patient works. So we'll draw this up. Come over here to the IV that's already in sight. So we'll take this, seal off the tube close to the Y port. So pinch that off there. There we go. And then Julie's just gonna put that in there and draw that back. Hopefully this one will work. And as I figured, it won't. There it goes. Never mind. So sometimes you need to pull back on the IV if you have it in the antecubital because the arm is bent. But with the blood filling up there, usually these 10 ml Vacutainers you'll get about 6 to 9. 8 is about what you're shooting for mLs into them. They don't usually fill all the way up. You just want them pretty full. And Julie just switches that out. There it goes. Flowing nicely there. Hurrah, hurrah. And so when she's done filling these 2 tubes, sorry I'm shaking a little, I'm holding this up here one-handed. I probably should stabilize it better. Alright. So we'll take it over to our centrifuge. Open up the line, let her refill here. Get over here in our centrifuge. So we have this. Obviously put them opposite each other. And we'll put it in our Drucker horizontal, whatever horizon thing. You can do it at 2,900 RPMs for most things at 12 minutes. For wisdom teeth, we actually just changed it to 10 minutes. Actually, where'd it go? We have a 10 minute, there we go. So 10 minutes for wisdom teeth, 12 minutes for implants, 18 minutes for implants on blood-thinned patients. And we'll get back here when we put them in the sites after the surgery. So here we have the 2 tubes. This top yellow part, there's a lot of fluid around it, but there are 2 big boogery things that are just the growth factors concentrated. So I'll show you those as we take them out here. So I'll hold one out so you can see, you can squish it. They're really squishy, and you can make them into a sort of a fake membrane. And then we just like to stuff them. Can you see in there at all? Okay, good. You just jam them right inside there. And literally, I sometimes just take my finger and stuff it down in the site. And then if you can suction around there, Steph. So then, it just fills it up. Not as visible on that side. We'll probably get a better look on the other side. Well, maybe it's because there's too much spit and heme going on here, but I can get rid of that. I'll show you the other side. Put one in there too. And open wide, sweetheart. There you go. Do 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 do. here being a booger again, you literally just plop it in there. And then I'm going to push down with my finger so I can get the bulk of the actual clot going on in there. Just stuff that in there and it fills it nicely. In fact, go ahead and suction around that stuff. I'm blocking it, so don't let your assistants suck it up. When they're new at it, they might have been pretty good and haven't done it much, if ever. I'm pretty impressed. Just these ones, though. Others have. But if you look inside, well, it's hard to see. These ones are kind of dried up, so they're not dried up. But it fills the site. Either way, let me dab at it and see if I can get a view. Well, it fills that site, so now the socket's full. There you go. And then turn it off there.